Hello, everyone. On behalf of Relief International, I bid you a warm welcome to the session on using data, building resilience to shocks. At Relief International, we partner with communities impacted by conflict, climate change, and disaster to save lives, build greater resilience, and promote long-term health and well-being. Being evidence-based is a core value for Relief International. We invest in learning and analysis. Sound evidence informs our actions, advocacy, and drives program quality, adaptation, and innovation. Today, we are excited to share with you examples from our Lebanon, Syria, and Turkey programs where timely use of data boosted community resilience in the face of shocks and stresses. Relief International has been working in these three countries for over a decade now in partnership with communities. In Turkey, 11 years, Syria, 12 years, and Lebanon, 17 years. We take pride that 98% of our team is local to the communities and countries where we work. In all three countries, our work is focused on promoting long-term health and well-being for the community through integrated cross-sectoral system strengthening approach. And I'm joined today by my colleagues Zainab Shaman from Lebanon, Usman Shah from Syria, and Mohammed Al-Shaban from Turkey. Zainab, Usman, and Mohammed lead Relief International's monitoring, evaluation, accountability, and learning systems in these three countries. Zainab, Usman, Mohammed, a very warm welcome to you to this session. Would you please take a few seconds to introduce yourselves to our audience today? Please share where you grew up, how long you've been with Relief International, and what drew you to data and this field of monitoring, evaluation, and learning. So Zainab, let's start with you.
Hello, everyone. Thank you, Najia. So I'm Zainab Shuman, and I'm from Lebanon. I was born in Lebanon. I act as the country meal manager with Relief International for around a year. I possess a robust meal background with over 10 years in the humanitarian endeavors across diverse projects and programs. Within my career path, I supported organizations in refining results, frameworks, and meal plans, as well as conducting reviews, learning studies, and evaluation. During my career pathway, I learned that data leads to insights, and insights lead to innovation, where good data leads to good decision making, which in turn leads to good outcomes. Thank you.
Thank you, Zainab. Osman.
Hi, everyone. Thank you. I grew up in Australia. I've been with Relief International as a meal manager for whole of Syria for a little bit over a year. And that involves coordination between a Northeast Syria hub and a Northwest Syria hub. And my path to meal came from conducting graduate research in the humanitarian sector. So there was a heavy data focus, and the data brought me to meal. Thank you.
Usman, great to have you here. Mohammed, turning over to you.
Thank you, Najia. This is Mohammed Shaban. I'm from Syria. I live in Turkey since more than 9 years. I joined RI since 8 years. My path with meal actually started from my first day working for humanitarian sector after the Syrian crisis. Actually, I'm passionate with the dealing with data analysis to strengthening the impact of humanitarian response. Thank you.
Thank you, Mohammed. And me, so as I said, I'm Nadia Haider. I grew up in Pakistan, and for just over a year, I have served as Relief International's Chief Program Officer. And why data for me? It's really part nature and part nurture. I was very much on a science track all the way through school, through a bachelor's in mathematics and statistics. So no surprise that I believe in the power of data. There really is truth in numbers. And data helps drive attention and focus, which is incredibly important when you are in this sector looking for durable solutions and impact at scale. So that's me, and it is so good to be here with all of you. Thank you so much for joining us. And before we jump into our presentations, I want to take a quick second and give you a recap of how the session is going to go. So Zainab, Mohammed, Osman are going to take about 10 minutes each to present the great work, the great systems that they put in place in Lebanon, Syria, and Turkey. And then we're going to go into a discussion. And that's going to take about 20 minutes. And then we're going to turn to all of you, our audience, to take your questions. So as you're listening to the presentations, please use the question and answer, the Q&A feature for Zoom to put your questions in so that we can turn to your questions when we get to the last segment of this session. So with that, and without further ado, I am going to hand it over to Zainab. Zainab, real-time data tracking by your team using digital tools, mobile applications, really helped put a stop to the spread of cholera in Lebanon. Would you please share with us how you made that possible?
Yes, Najia. So actually, Najia, in Lebanon, Relief International Comprehensive Alert and Response System plays a pivotal role in providing immediate relief and longer-term recovery from disease outbreaks. Like, for example, during the cholera outbreak, which raised in 2022, the digital tools and mobile systems that were used by Relief International Lebanon were beneficial for real-time data entry and tracking, promoting better accuracy and timeliness of information. To better elaborate about this, I can reflect this through the presentation. First of all, it's worth to mention that Relief International Lebanon has been operating for like more than a decade ago. It started operating in Lebanon in the middle of 2006 war. Then it has been legally registered since 2007. Relief International's mandate is fully aligned with the humanitarian principles of humanity, neutrality, impartiality, and independence. To go back to our point, which is in relevance to cholera outbreak, this outbreak started or was raised in October 2022, where 29 cases were recorded in Lebanon. Then these cases started to increase month after month, which raised like 6,158 cases by January 2023. The most affected group of the cholera cases, it was like the age group of people under 15 years old. Of course, all the people of all age groups were affected, but the severe impact was on age groups under 15 years old. As you can see, the intervention and the cholera outbreak was spread countrywide in all 9 governments in Lebanon by 2023. And the suspected cases were reported in Beirut, Akkar, North, Mount Lebanon, Bekaa, Baalbek, Hermel, South, and Nabateeh. This was associated with 23 death cases. And it's worth to mention that females represent 53% of the cases that were affected by cholera outbreak. Next slide, please. So, in response and to the cholera outbreak, what was Relief International Lebanon Country Office response? First of all, we raised awareness on cholera symptoms, transmission, preventive measures, and treatment. We conducted risk communication and community engagement activities with particular attention to vulnerable groups, including pregnant and lactating women and children under 5 in Minyadaniye, Tripoli, Zgharta, and Akkar. We also responded to alerts through the rapid response team and conducted contact tracing, sample collection, and coordination with relevant stakeholders. We also distributed oral dehydration solution to targeted households in Akkar, North Bekaa, and Baalbek. It's also good to notice here that doing this won't be really achieved without the data collection tools that we we mentioned earlier. In terms of using awareness session monitoring, pre-post training while providing the awareness sessions, post-distribution monitoring, in addition to many other monitoring activities that helped us to ensure proper data collection to all monitor the process, as well as the change in terms of our intervention. All the data fed into our system, where we represented and visualized this data through Power BI, reflecting dashboards where we were able on weekly basis to monitor the updated figures. Next slide, please. So what did the data enable us to do? Relief International, as I mentioned, utilized the digital tools, mobile applications for real-time data entry and the tracking. As I mentioned also, the real-time data tracking was reflected within our dashboard. Also, we were reporting on activity info on a weekly basis. This tracking of data in coordination between the program teams and the meal department enables us to have seamless collection and the processing of data from multiple locations simultaneously, enhancing accuracy and timeliness. We also focused on critical indicators of cholera response, such as the distribution of oral rehydration solutions and the execution of awareness sessions. Also, it enabled us to have a streamlined and accountable data management process, clear real-time picture of the impact of Relief International's efforts, because having the data collected on a regular basis, revised and verified on regular basis, validated on regular basis, and reflected on dashboards, it helped us to have a real-time picture of what's going on in the field within the community we are serving and intervening. This also enabled us to have a participatory approach, ensuring that major project stakeholders are highly engaged in all implemented activities, where the program teams, the community volunteers who were recruited from the community itself to support in this intervention, as well as other partners, they were all involved, collaborating together to ensure that this data is reported on time, is accurate, and is shared in a way that reflects the implementation on field. Next, please. So after we, or within the intervention, of course, we were holding as Relief International Lebanon different lessons learned to ensure having what should be improved, what were the successes, and what are the challenges that we need to mitigate for as proactive measurements for later improvements or for future interventions. So as part of the major lessons learned that were collected within our exercise, it was collecting and using up-to-date information is very important and crucial, where we need to conduct monthly data reflection meetings to track indicator achievements and analyze factors affecting project targets. Again, I mentioned having, for example, the monthly data reflection meetings is part also of engaging all the project and intervention stakeholders, because this keeps all the counterparts aligned. They check the indicators on regular basis. To plan the activities and set monthly targets to ensure teams achieve planned goals, and to gather feedback and data collection tools to improve future processes. As we know, data collection tools, they don't remain the same, which is something that Relief International ensures to be conducting from time to time on a timely basis by improving these tools and upgrading them to fit the intervention. On another note, one of the lessons learned is engaging with local community and local institutions is a key. like we need to maintain strong relationships with local authorities for swift responses during outbreaks, and recruit community volunteers for gender balanced teams, which was, as I also mentioned, Najia, a strength point, because having the outreach volunteers and the outreach workers, even for the rapid response team, recruiting people from the community itself where we are intervening, it was a highly beneficial factor to ease and facilitate our intervention. And the last one is to stockpile personal protective equipment and supplies for preparedness in similar outbreaks as kind of proactive measurements that should be conducted by Relief International. Thank you.
Thank you so much, Zainab, for that great overview. And you are so right. I think part of the magic at Relief International is that our teams are from the very communities where we're working. So we derive people and our power from the communities with whom we partner with. So I'm going to turn to Mohammed next. Mohammed, after the devastating earthquake in Turkey last year, February, your team, your very small team of 4, not only enabled an evidence-based response, but then continued to inform implementation in over 200 locations in 9 provinces. That is quite the feat. Would you please share with us how you made that possible?
Thank you, Najia. In Turkey, actually, with 80 million population living in 80 provinces, hosts the highest number of refugees in the world, with 3.1 million Syrians and more than 300,000 refugees from other nationalities. Relief International has been working in Turkey since 2013. Currently, Relief International implements activities in 5 provinces across Turkey, providing specialized health services for refugees, focusing on mental health, psychological support, MHPSS, physiotherapy, prosthetic and orthotics, community health, and livelihoods. On the coldest period of the year in the region, February 6, 2023, a magnitude 7.8 and 7.6 earthquakes struck the region of Turkey near the northern border of Syria. The 2 earthquakes directly impacted 14 million people in Turkey and Syria, left 108,000 people injured, and more than 54,000 people lost their lives. The impact was felt heavily in 11 provinces where the almost 16 million people reside, including 1.8 million Syrian refugees. Based on the rapid need assessment conducted by Relief International, the results were shocking. All the participants indicated that their houses were partially or fully damaged by the earthquake. All participants lacked the financial means to meet their basic needs, with increasing needs for shelter, food, and wash, in addition to urgent medical support. The needs assessment about physical rehabilitation services in the earthquake region showed that 33% of the physical rehabilitation centers were fully or partially impacted by the earthquake. And there was a need for physical rehabilitation specialists to respond to the massive wave of people in need for physical rehabilitation services. Next slide, please. Actually, about the response, Relief International country office in Gaziantep, which is 40 kilometers from the location of the first shock. So the team was impacted directly by the earthquake. After 72 hours of the disaster, and after ensuring the safety of its team, Relief International launched multi-sectoral rapid need assessment with the support of its local partners located in the impacted cities. In March, Relief International conducted a second qualitative physical rehabilitation need assessment. In the same month, Relief International conducted a WASH need assessment to explore the urgent needs in the impacted area, to use the findings to direct Relief International response. Later in June, Relief International conducted a second WASH need assessment in the affected region to set a baseline for the PHA WASH response. In responding to the earthquake, Relief International intensified its services within 3 sectors: health, protection, and WASH through distributing emergency kits, providing physiotherapy consultations, PSS consultations, and also mobility aid devices. In addition to installing communal latrines, household latrines, communal showers, laundry units, and laundry machines. In terms of the meal response, at the onset of the earthquake, Relief International was in the transitioning stage for the data collection and management system from the traditional forms of paper and Excel templates to a mobile online platform, which is Kobo Toolbox. When the earthquake hit the region, the system enabled Relief International to quickly deploy data collectors who were quickly trained and ready to collect data in the affected areas in 7 provinces. The system enabled a small meal team located in different provinces in Turkey to follow up remotely with maximum control, the data collection, analysis, and reporting processes. This was helpful as the Relief International country office was closed for more than 6 months after the earthquake. The primary data collected within the first 2 weeks of the disaster enabled Relief International to identify the initial emergency needs of people and started preparation for responding to them, which was done initially through Relief International's own fund. At the same time, Relief International continued to monitor the situation closely and conduct more assessment to get more details and information about the unfolding needs while communicating with donors and other stakeholders to fund and coordinate the projects responding to urgent needs of affected communities. Relief International operations, emergency operations were explosively expanded. And so the meal system of Turkey was ready with a few meal personnel to work at maximum capacity to monitor, collect, control, and manage the data generated from projects of 3 donors, 15 mobile teams, 7 mental health and physical rehabilitation centers, in addition to WASH activities in 200 locations and 9 provinces across Turkey. The communication network was not heavily affected by the earthquake, which enabled Relief International to perform surveys, post-distribution monitoring, and evaluations remotely through phone calls, interviews. Relief International hired daily enumerators as needed to perform data collection tasks for the meal activities, while the core meal system or the core meal team were responsible for cleaning, validation, verification, analysis, and reporting tasks. Relief International team continued conducting field visits to the project site to monitor the project's activity closely and to provide the needed support to the field staff regarding the online tools and other meal-related tasks. Relief International adjusted the complaints and feedback mechanism and applied a hybrid mechanism, compiling in-person and online channels to adapt the new context where the operations of outreach team targeted people in their temporary settlements and camps. Relief International used applications such as Python, Visual Basic on Excel, Log Alto, Power BI, and other AI tools to perform more tasks in a shorter time, which multiply the productivity of meal system. In terms of the protection, Relief International was able to use AI efficiently with very low cost and very restricted data protection rules that ensure the safeguarding of data of the project data and privacy of clients' information. The field teams from different partners had different layers of access to the data according to their needs and specialties. And all the data was stored in Kobo Toolbox account server of Relief International, which had the only authority to delete or edit the records of field teams. The online system enabled Relief International to easily collect, document, and archive the means of verification and also identification proving documents, including beneficiary consents, donation certificates, and cash receipts. The system enabled Relief International technical team to have direct access to the potential beneficiaries and make required verification to provide the final approval of to field teams to proceed with the donations or cash payments for the most in need individuals. Relief International developed live dashboards to be a live informative tool for the program team and decision makers through visualizing the project indicators, progress, and also the technical analysis for specific aspects of the project based on the recommendation of technical and program teams. These dashboards were important tools for the team to make informative decisions and adjust the implementation plans quickly based on the feedback and progress achieved. For example, in the PHA emergency project, the team noticed a high difference between total beneficiaries who were identified for potential cash support and the ones who received this support. And after checking the details, the team realized that the old transfer modality through PTT branch was not as effective as expected because the people could not afford transportation to these branches. So some of them were living in far camps, and there were few functioning branches in the earthquake affected area, as most of them were damaged. So the team converted this modality to deliver the support in cash, as it is more convenient with the earthquake affected areas. The team conducted continuous changes on these dashboards to improve the quality of these dashboards and to respond to the team needs. Can you go to the next slide, please? Thank you. What we learned actually for Relief International Turkey, AI technology is in the meal system is a key to success and agility. The more advanced applications you use, the more flexibility and capacity you will get to respond to the sudden expansion of the operation in your country. Technology is a powerful tool to clean, process, and protect the data with a fewest meal personnel needed, which makes the meal very cost efficient. The online system is more efficient in emergencies in terms of data flow and data protection. The system saves the data of loss or damage by earthquake or any other reason. The system enabled Relief International to keep the data of the physical rehabilitation center in Antakya with all the means of verification despite the center's damage. So data was not lost or impacted because of the earthquake. The more training you provide to partners, field team, data collectors, the more quality data you will get. The last session is, or the last lesson is, using one software or platform will not be enough to run meal systems smoothly and at maximum capacity. The team should use a combination of many tools and platforms that all work together to get the needed information for a faster, more effective, and reliable evidence-based decision-making process. Thank you.
Thank you so much, Mohammed. So much good content in what you said, and we're going to come to it in the discussion that we have following Osman's presentation. Osman, I'm going to turn to you. In Northeast Syria, Relief International is among a handful of organizations providing much needed health services. And your team and the data visualization that your team has been able to do helped not only stop the breakout of scabies, but also the rising rates of anemia. Could you share with us how this was accomplished?
Thank you. As Najia mentioned earlier, Relief International has been operating in Syria for roughly the last 12 years. We provide essential services to the country's most vulnerable populations. In Northeast Syria, Relief International provides critical health, nutrition, and protection services to communities. We do this through helping support health facilities, including via USAID support, as well as other programming such as protection spaces for women and girls, as well as community health, hygiene, and nutrition promotion via community health workers. One of the locations we work to provide such support in Syria is the Washukani camp, which is located on the outskirts of a city called Al-Hazakeh. It's one of the major urban centers in Northeast Syria. The camp was established in 2019 following an increased arrival of internally displaced people coming from other parts of northeast Syria into the vicinity of Al-Hasakeh. So Relief International supports this population through a health clinic, as well as a protection unit located at the camp. So in mid-2023, Washoe County camp experienced an outbreak of scabies. Scabies is an infectious skin condition, and it can lead to severe skin rash and irritation. It disproportionately affects infants and the elderly, and it thrives in conditions where people are living in close proximity, but without good access to hygiene and sanitation. So conditions that we see at Washoe County camp. Next slide, please. So what was our response to this outbreak? Well, firstly, through weekly analysis of our meal team's data, as well as review of our monthly dashboard updates, our meal team in northeast Syria noticed a rise in scabies cases. This was confirmed with data collected on site at the camp with our clinics, doctors. Our team then investigated in conjunction with the health team at the facility. And Washoe County camp staff confirmed that weekly cases had trebled from 9 to 30 within a week. So what actions did we take? RI informed Washoe County camp management that we had evidence of an outbreak. We also informed partner organizations working in the same community. Aside from administering the necessary medical treatments to patients affected, Relief International's community health workers began a campaign of awareness raising through daily messaging to patients and their relatives who were coming into our health center at the camp. Our NEST team also posted information flyers in the vicinity throughout the camp to raise the overall level of awareness. How to recognize symptoms, the treatment, etc., who to contact. The health team also conducted contact tracing, and this information was shared with another key partner organization, ACTED, which then went ahead with household level interventions, such as replacing and destroying infected bedding in coordination with camp authorities. Our Washoe County team also conducted case management, so tracking the treatment of individuals who presented at our health facility, as well as any other potential household members who would be affected. We also tracked the number of incoming cases, which you sort of see an example of on the screen. So we see a rise in cases between June, July, and August, and then we managed to arrest the cases. In terms of protection mainstreaming, our protection staff also were trained about scabies and how it presents. This was done in order to encourage them to be able to refer cases to our camp's health team. So that included sharing contact tracing information with our health team, as well as providing flyers to share with community members coming in for protection services. Next slide, please. So what did this data enable us to do? So Relief International's scabies outbreak response in Washoe County, it's a small but demonstrative example of how improvements in the way we harness data can lead to more responsive and accountable programming in needy populations, such as those displaced to camps like Washoe County in northeast Syria. So how did we get here? Well, in early 2023, our meal manager in northeast Syria, Mohammed Osman, developed and launched a new trends and analysis data dashboard. Once it was introduced to other staff, such as our health program team and our hub management team located in northeast Syria, it was agreed that regular review of the data dashboard presented would occur. So these monthly data review meetings now allow for a review of key issues and trends arising at various project locations, and for a discussion to occur about trends that are emerging and any programming interventions or adaptations that might be required. So it was in this context that monthly scabies case data from Washoe County was tracked and flagged and mapped by our meal team in coordination with our health teams, and necessary response steps were taken. So this small case demonstrates how important it is that data is collected and stored, but also used more dynamically, including via trend analysis, better visualization. So using tools like we do allows for data to be transformed from a sort of static state to allowing it to tell a story, so that we can do more with it, which is critical, especially in humanitarian contexts like Northeast Syria. Importantly, Relief International is building upon these gains and scaling them up and out based on this initiative by our Northeast Syria team. So we've redeveloped our data dashboards in Northwest Syria, and we're also doing the same at the whole of Syria level, so aggregating data from Northeast and Northwest Syria. And this is allowing us to better assess risks, important trends, needs that are arising, and also conduct any other necessary analysis for more effective evidence-based responses to the kinds of shocks that impact communities that we provide essential services to in Syria. Thank you.
Thank you so much, Usman. Mohammed, Zainab, Usman, thank you so much for the amazing work that you all did, and of course for these presentations and bringing this knowledge to us. So let's shift to discussing this great work that you've done. And let's start from the most basic question that always comes up, which is, we all collect data. We collect tons of data. But collecting data is not the point, right? As you all are saying, it's really about how that data gets used, if it's being used real time to inform our actions, to really do the things that you were able to do. And that was the amazing thing. You all, as Usman had said earlier, were able to liberate data from the meal cemeteries and bring them to action, to inform the work, to make our work smarter. And the question I have for you is, that must have something to do with the culture that exists, right? Because that requires collaboration with the program and the monitoring evaluation team. And so I'm wondering if you could share with us 2 or 3 characteristics that you find in your teams, in your respective teams, that made this possible. And whichever brave soul wants to take that first, just unmute yourself and go for it.
Okay,
all right,
Nasha, I can go for it. Okay, so as you mentioned, not all teams are great in real-time data analysis and learning, but there are factors that contribute to real-time data. So for us as the Relief International Lebanon, I believe this was building the system which was based on the program targets. The system that included the meal plan, the information indicators table to monitor the process, the figures on regular basis. Also, it was about the program compliance with accurate data collection, responding to the trainings that they received from the meal department and the information management. Also, another factor was responding to the intervention in areas where the shocks are at their peak. So we targeted the areas where the intervention was needed. In addition to, as I mentioned, the great collaboration between the program and the meal department, which enabled a good and real-time data. Other technical factors at our level, as I mentioned, we used different tools. We had tracking tools. These tracking tools were checked sometimes on daily basis because we were in an outbreak. In addition to having the data validated and verified by the meal team on regular basis. As I mentioned, also the data reflection meetings through my presentation. So these data reflection meetings, we usually get them, Najia, on monthly basis. But during the outbreak, the moment we record that there is something which needs our intervention on spot, we go for an what we call it priority meeting to discuss like kind of trends and data that are observed and agree with the program on what are the mitigation measures, how do we want to proceed, how are we going to adapt and modify our intervention accordingly.
Thank you, Zainab. Mohammed Usman, do you want to add anything to this?
Yeah,
Go for it.
thank you. Thank you, Najia. I can be next. Actually, thank you, Zainab. Zainab covered most of the points, so I just want to not repeat what Zainab has said. From Turkey, Relief International Turkey, what we do usually, we, in order to enhance the coordination between the meal and the program teams in terms of performing and tracking the data, we are following many regular actions to do that. It starts from the beginning, from the coordination when we designed the project together, when we designed the data collection tools together. So as meal team in Turkey, we don't do that alone. We just get the program team and technical team integrated and involved in all the meal actions that we are providing. We set our plans together. Even we do jointly field visit to partner centers, which really they are very valuable. They in these joint field visits, you can understand the projects, all the gap, you can identify every small gap in the implementation because you have the expertise from all parties. So you can look to the issue or to the activity from many angles. So that's why these coordination, these bi-weekly meetings and GRM meeting, grant review meeting on monthly basis, and also the joint field visits are really supportive to get the programs and all program teams integrated and involved in the meal activities. Thank you.
Thank you, Mohammed. I think that is so key, you know, that joint ownership that you're talking about when you design together, when you sort of adjust together, when you're visiting together and you're seeing it, that really, really plays a huge role, is what I've seen in my life here. Osman, anything from you?
Yeah, so I'd echo all of the points raised by my colleagues. I'd also just say, I guess, culture-wise, at a more sort of abstract level, I guess it's important to make the leap from approaching the data as being strictly for meal purposes. You know, it's program data, and you know, it's for the benefit of the communities that we're servicing. So better harnessing it for those storytelling purposes allows us at least to engage in a conversation with our health or protection or nutrition colleagues or management to improve quality of services. So I think just approaching it not as a wall of numbers, a wall of figures, but yeah, just listen to it, and it's also liberated from meal. Yeah, it's all of ours, and it's mostly the communities. Thanks.
Yeah, that's my big takeaway from our conversations, Usman. Liberate the data and its program data. Mohammed, I want to turn to you and go back to the time that the earthquakes in February struck last year. And, you know, our team, as you were saying, is very local to that area. And I'm hoping that you could bring us to that time. You could give us a little bit of a sense of the earthquakes had just happened and the aftershocks were still in play. And here's our team that is trying to take care of their own families, figuring it all out. And at the same time, they're going out there in the community to do the assessments to get those services going that are needed. Could you help all of us, this audience, understand what was going on at that time?
Yes, thank you, Najia. Actually, for our team after the earthquake, it was a really difficult time that we passed through. It was a new experience for all people in the country. During that period, I remember we had to work in our own cars. Some people had to leave their families in safe place and to go to the field to support and collect data. Actually, these I mean, during these times, we were all thinking about, okay, there are emergency teams who were like securing and trying to get people out of the rebels, and then what is our role? So from our side, we were thinking that it is our duty and our responsibility to support those people who were saved from under the rebels, because their journey actually started after this secure, not before. So it's not only about securing and saving their lives. So the suffering starts after that, because they lost their homes, they lost everything behind, and here it is our role to stand up and to provide the needed support. Actually, I have witnessed a lot of commitment and very high commitment and like self-motivation from the team despite these hard times. So it was really, really difficult.
Thank you, Mohammed. I took away from your presentation how important the tools were in sort of as a force multiplier, you know, really amplifying what our team could do. And use of AI, use of data online. As you did all of this, what safeguards did you put in place in terms of data privacy to make sure that data was not compromised?
Thank you. Actually, safeguarding and protection measures are really important in the humanitarian sector and in general. Actually, for our system in Turkey team, we had taken different measures in order to make sure the privacy and the protection of our clients' data. For example, in the online toolbox platform, we had created restricted access to all the end users of the data collection forms. So the users from X partner cannot see or access the data in that were submitted by Y partner. In addition to that, we had like a good practice of having backup data for the collected data on server. So we had on monthly basis, we saved the data on box in the toolbox servers as a backup in our box drivers to make it safe in case anything happened for the server. The third one is we provided data protection awareness for all the RI staff and partner staff to make sure they have high sensitivity towards the client's data. And finally, we get consents from all the beneficiaries about the data that we are collecting and who has access to these data and what we are going to do with this data. With all these measures, of course, this consent was very fully compliant with the Turkish data protection law. So we were very clear transparent with the beneficiaries, and we were very 100% compliant with the Turkish data protection law and also RI and donor policies.
Thank you so much, Mohammed. Zainab and Osman, I'm going to turn to you now. The data systems that helped really serve as early warning systems in Lebanon and in Syria, are these continuing to work, and are you able to continue to monitor health trends and any other spikes that are coming up? How are the systems sustaining? Osman, maybe, or Zainab, you seem ready.
Whatever, Osman, you wanna start?
Sure. So thank you. Yeah, so those kinds of warning systems like eWarn are monitored in the health facilities that we operate in. So it's just one of a range of actions that are taken as part of an emergency response. So, I guess it, an emergency or an outbreak in my case is flagged at a specific facility, and then there's a sort of a tree of communication. So at least within the organization, but then with partner organizations, and then the necessary steps are taken sort of at the facility level or within our organization or partner organizations in conjunction with local authorities or specific technical working groups, for example, a health cluster or a nutrition cluster. Yeah, and I guess response is collaborative in that way. Sorry, I'll hand over to Zainab now.
Okay, from my side, just adding to what Osman mentioned, for Relief International Lebanon, I want to confirm that we kept or we prolonged our intervention like up to 14 months after the outbreak. So we kept following up cholera cases and providing awareness sessions, preventive like messages up till January 2023, and we kept reporting to activity info on a weekly basis and providing also our figures. We're also mitigating our intervention within the current health projects that are running. So within our intervention during certain awareness sessions with the lactation specialists, with other community health clubs awareness sessions that are implemented on field, we ensure that these messages toward the shocks and such outbreaks and diseases are communicated with the community to ensure like we are systematic and we keep the same chain of information that is transferred to the community. Knowing the situation now that is occurring in Lebanon, we have also some other cholera cases that are raising. With the background that we have in cholera intervention, the background of having Relief International staff who are recruited from the community itself, of having the system already in place, having the tool in place, having our intervention design in terms of what kind of activities should be implemented on field. So I believe Relief International is ready to provide the needed response, whether it is by itself or in coordination with other partners or international NGOs.
Thank you, Zainab. Thank you, Osman. This next question is for all three of you. And I want to shift the focus to learning. And you all have been referring to it throughout our conversation here. But let's just focus on learning for a second, because that is so key to everything that you've said, you know, that culture of learning. And you can have it in so many different ways. It could be in the form of meetings. It could be in the form of just informal collaboration. And I was hoping you could speak just a little bit to that learning culture that exists within all of your teams. And how is it that it shows up? How does it manifest? Mohammed, maybe we'll start with you.
Sure. Actually, in Relief International Turkey, the culture of learning, we as a team, we worked on the culture of learning through many aspects. The first one, as I said, through, as I mentioned before, about the regular meetings that we are doing, the reflection meetings that we are doing on bi-weekly basis and also monthly basis. In addition to that, for Relief International Turkey, we are doing lessons learned after each midterm or final evaluation. We present all the findings of these evaluations or surveys or need assessment and discuss them with all departments in order to learn and to improve our system. In addition to that, we are not doing these learning sessions internally alone. We are also doing this with partners to hear from the field team who are on the ground, who knows better the client's needs and what are the challenges that they are facing. So we start from the bottom to the top in order to have this channel and this flow of information from down top and top down act as active as possible, which makes the which makes always the steering of the programs as correct as possible for Turkey operations.
Thank you, Mohammed.
Yeah.
Osman, Zainab, anything to add? Zainab?
I will take it from Muhammad. Thank you, Muhammad. Thank you, Najia. So I just want first to emphasize what Muhammad mentioned, Najia, because the lessons learned, the practice is a common practice among all Relief International. From our side, as Relief International Lebanon, we ensure having these lessons learned event on, and as I mentioned, data reflection on monthly basis if it's not an emergency response. And also we have the lessons learned, the practices that are handled on a quarterly basis. These lessons learned practices, we ensure like having all stakeholders of the project, internal and external, whether the program team, the technical team, the partners, if we have sometimes from the health facilities, people who are frontliners working with us, we ensure that they join us to promote continuous improvement and also to ensure like we're building the capacity of all the people contributing to such an implementation. This will help to share knowledge with the stakeholders and share also common practices. This empowers the team members to be more effective in their roles and to contribute to the organizational growth and resilience. This will also and is helping us to enhance the adaptability, which we all know, like within our context in terms of data collection and management, the collaboration and learning and adaptive approach is a common practice that is very important within all organizations and within all humanitarian sections that are providing their intervention. So this helps us also enhance the adaptability, where we can adapt the strategies and approaches to certain changing circumstances and emerging challenges, whether it's at the level of the field, at the level of the teams, at the level of the data itself. And this adaptability is very important to sustain the long-term impact, because if we don't adapt, if we don't take proactive measurements, this won't help us to improve and respond to challenges.
Well said. Thank you, Zainab. Osman, anything to add?
I couldn't possibly add to that, but yeah, I'd just say that at the whole of Syria level, yeah, our approach is much the same as in Turkey and Lebanon, and yeah, the tools and the fora, and but also the challenges. Yeah.
So I'm going to pick on something that all of you have been mentioning, which is partnerships and local partnerships, especially. I'm really hoping we can use this as our last question of this section and then turn to audience questions. But could you say a bit more, and you've touched on this, but say a bit more about local partner capacity, that local partnership, and that two-way, learning from them and helping them learn from us. What does that look like?
Yeah, I can answer first, because actually in Turkey, our main approach here is to provide to implement projects through partners. We have around 90% of our operations are through partners. So actually working through partners is has a lot of advantages for Relief International Turkey. As you said, because we learn from them and they learn from us. Building the capacity of partners in Relief International Turkey, we have provided, we worked with partners on all the way to implement high quality programs through providing technical support, training, and also the most common practice is the coaching sessions to the meal personnel, if we are talking about meal only. So working with partners, meal staff, provide us like a strength point, because they are always in the field. So they are in the centers of physical rehabilitation or mental health or any kind of projects. They are in direct contact with the beneficiaries. So they know better what are the challenges, what are the problems, what is the interpretation of the data they are collecting. So they are very valuable source of information and data. So having them trained well, having them with like accepted or high capacity is really important for our programming in order to ensure high quality implementation and monitoring. As you said, we don't all the time provide them capacity. Also, we learn from them. We had at Relief International, we had very great ideas that was suggested by our partners. They provided us very good solutions for meal and also for programs as well. So working with partners is really good to address the access challenges, the language in Turkey. Here we have, as you know, the most number of refugees are Syrian, so they speak Arabic, but in the local community are speaking Turkish. So having these local partners is enabling Relief International to be closer to the targeted groups and to provide them the most suitable services with their languages, especially if we are talking about mental health. So partnership for Relief International Turkey is really strong point. And I will leave the floor for my colleagues also, they can add more points.
Thank you, Mohammed.
I wanna thank Muhammad for the elaborated answer, and I just wanna add some few other top-ups on what he mentioned, because what he has said is greatly similar to what I wanted to say. But on top of this, allow me to say, like, our Relief International's relationship with the local partners is kind of a win-win relationship. So we, as international NGO, we have a certain level of expertise to share with them, while they also have another level of awareness of the community they are working in to share with us. They are aware of the norms, the culture, they are aware of the security situation of the area itself, the level of access, also they are close to the people they are there. You can consider them as real frontliners who can provide you with a real image of the context you are intervening in and you are serving. So yes, it's a win-win strategy. It's a kind of collaborative relation for us to enhance the intervention, and for them as our major stakeholders, and let's say I can call it the backbone for our implementation in the field.
Osman, looks like you're getting ready to say something.
Yeah, I mean, that was all beautifully put, and I'll absolutely echo both Mohammed and Zainab in terms of my experience in Syria. So yeah, that is the approach. You know, it's sort of you know, in my experience in Syria, we are working with partners through consortia as well. So that's sort of a more formal means of partnership, and it allows for those strengths and capacities at the local level to be kind of leveraged, but also to provide just a means of having a greater impact collectively. And I guess I'd say it's a means for RI to leverage other forms of expertise, you know, sector expertise, for example. As mentioned, I think mental health, areas that we're seeking to move into. We don't yet have the capacity, but so yeah, absolutely. Building capacity is a two-way street, and that's definitely borne out in my experience in Syria. Thank you.
Thank you, Mohammed, Zainab, Osman. With that, we're going to shift to audience questions, and we have some really great questions from the audience. And let's go with a question around challenges that I'm seeing here. And I'm going to be looking at a different screen. So if I'm looking off camera, I'm reading questions. So this is a question for all three. And the question is, what were some hidden challenges, or just challenges, you faced during data collection and analysis?
I can start myself. Okay. Actually, for Relief International Turkey, especially talking about the period after the earthquake, everything was challenging in general.
Yes.
Yeah, because you are working in emergency situation. You are trying to collect data from people who lost everything, who lost their relatives, who lost their homes, who are living in temporary settlements, who are looking for basic needs. So collecting data, especially during the need assessment stage, it was really difficult for them and for the team. Imagine like a lady who's telling you her story about her house or her children who were lost during the earthquake. And morally and ethically, you cannot stop her of talking about her story. So it was really challenging for the data collectors on the ground to collect the needed data about the needs of the people affected by the earthquake. It also was like, it was mentally painful for the field team because they heard a lot of hard stories from the people on the ground. This was actually one of the challenges during the data collection. In addition to that, we had some challenges related to the securities or permission for access to specific locations. Sometimes we were not allowed to get into specific camps. That really was challenging for the team, who were trying all the time to coordinate with the local authorities in order to get access to these locations and serve the people. There are a lot of challenges, but I will mention only these two, and I will leave the floor for my colleagues.
Yeah, a very complex and really heartbreaking situation, right, Mohammed? Those aren't the challenges you usually think about when collecting data, but thank you for sharing that. Zainab, Usman, anything from you guys on challenges to data collection?
I guess I'd say, yeah, I'd echo once again my colleague, and I'd say in Syria, the collection of high quality data is safely, ethically is maybe even more pronounced. So that challenge is ongoing, and at certain periods it's just not possible due to outbreaks of violence. So that's definitely something that needs to be negotiated on a sort of in response to the evolving situation, and adaptations have to be made in order to keep data enumerators safe, and as well as communities that we're engaging with. Yeah.
Thank you, Usman.
Okay, so on top of what my colleagues mentioned, for Lebanon in specific, for cholera outbreak, I can't mention specific challenges, but the challenges are common for all implementation, which is kind of the having, in Lebanon, the tension between the host community and the refugees is sometimes causing restrictions in terms of data collection. And another challenge, for example, for us at different activities that we needed to implement lately in terms of meal data is the situation in South Lebanon, where the security of the area itself is causing restriction in terms of accessing people. Even if you want to call people by the phone to collect some important information, as Muhammad mentioned, they start informing you about their sorrowful stories, about how they left their houses, their villages, their families, and everything behind. And they even are not willing to focus on your question or what type of data you really want to collect from them, more than focusing on expressing themselves, their suffer, all what their feelings and sorrow of the current situation. So basically, this is it.
Thank you, Zainab. Yes, I mean, this brings to life what you all are saying, the importance of the psychosocial support that Relief International is now in its health strategy, integrating more and more with everything. that we're doing, because that is so key and it hits you. It's a visceral need. Let's go to some other questions from our audience. There's a question for you, Zainab, specifically. And the question is, which intervention in Lebanon seemed to be the most effective at curtailing the spread of cholera? And I think you touched on a few different things that the team was doing. And the question is saying, was there one above all that really helped with stopping the spread of cholera?
To be honest, I can't say like there is one which is among the other, because it's kind of complementary activities that contribute to achieving the change you want and the result you seek on field. So the rapid response team, they played their role in terms of alert received, alert responded. So this contributed as a factor. The awareness session that where we transferred certain messages in terms of how to deal with cholera and how to respond with certain practices, the distribution of oral rehydration solutions. So the messages and the preventive messages that we keep transmitting. So while having any intervention, it's not one activity or it's not one thing that contributes to having a change. And we all know this, it's always about different factors that contribute to this change. And for example, let's say you are having, other than cholera, you are having an intervention of providing physical rehabilitation to children who have certain disability. So these children, you can't say that only providing them with physical rehabilitation help to reach the planned result. It's always also maybe about the psychosocial support that you provided for them, which motivated them to continue their physical rehabilitation sessions. So different activities, they contribute to the success and the change that is planned to be seen.
Thank you, Zainab. We have a few more questions coming in, and I'm trying to figure out which ones you've already touched on during your presentations and which one we want to bring out a little bit more here. So there's a question here about the e-warn system, Osman, that you were talking about. And the question is, how did you connect your system with the national system when faced with outbreaks to ensure that the National Early Warning, Alert, and Response Network was active in the outbreak and monitoring and being managed? And that question is addressed to both Zainab and Osman. Excuse me.
I think due to the specifics of our work in Northeast Syria, due to we're working in a sort of an area of, let's just say, contested governance. So that notion of a national response, I'm not really sure I can possibly begin to adequately answer that. So I'm going to hand over to Zainab and hope maybe she'll have a better idea of, okay, what does it look like in Lebanon? Thank you.
Okay, so to be honest, Najia, in Lebanon, one of the major challenges that we have seen here and recorded is that in terms of recording and in terms of documenting the numbers and during the outbreak, there's still need, or there is this gap between the humanitarian organizations and the national system that is in place. So there is a coordination between the Ministry of Public Health and the organization. Also, international organizations and local organizations, all stakeholders that are implementing such interventions on field. There is also this working group, the sector working group, who is there. There is a continuous communication. There is a continuous collaboration at this level, but still there is no digitalized system in place that link the information and the data of these organizations to the national system, which is something that was raised lately, and we're looking forward to have it in place.
Thank you, Zainab and Osman. And the next question is really for all of you. And the question is, excuse me, the question is, what are your top two pieces of advice for other teams who are wanting to foster a culture of evidence-based learning, for building that greater community resilience and that contributing to that long-term health and well-being? How are you able to do it, and what would you advise for others? How should they go about fostering that culture?
Zainab,
Do you want me to? Yes, thank you, Muhammad. I'll take it at first. So actually, I have two pieces of advice. There are many, but for me, the most important two pieces of advice are, first of all, every team member on field should behave as a critical member of the defense system against this outbreak that we are responding to. So people should act proactively. They should consider like every data collected is their responsibility. Every observation is their responsibility. Every act is their responsibility. Another piece of advice is like the accountability and accuracy. So every number collected is a critical factor that contributes to real-time reporting and contributes to real-time response. So during outbreaks, Naja, time is limited for validation and verification. So all team members should be of a high level of accountability and and responsibility while collecting data, while reporting their observations. Whatever was the level of these observations might be minimal, it might be of a critical or of a high importance, but it should be reported and documented and transmitted, because this might affect people's lives and as well as the whole intervention.
Thank you, Zainab.
Thank you.
I believe I can be next. Actually, for Relief International Turkey, I can add also two lessons learned. The first one is about working with community, as Zainab mentioned. For me, I can say the meal system should start from community and end to community. And between these 2 points, the starting from community and ending to community, the team or the system should keep the channel as much active as possible in order to reflect all the needs or the feedback, all the impressions of those people or like the group that you are working with to the decision makers and to Relief International in general. Keeping this channel and keeping this link active ensures the accuracy and the quality of your programming. The second part is to keep improving the meal tools that secure highest level of accuracy and technology, because these data that you are collecting through these tools will work or will function as the compass for your operation. With these tools, the program team will understand better what are the needs and will accordingly will design the most suitable response to support the people in need. So these are the two golden lessons learned I can share with the team. Thank you.
You were on mute, I'm sorry.
Sorry about that. Osman, over to you.
Yeah, once again, my colleagues put it so beautifully. So I think, in those conditions that Zainab established, if we then move to the kind of more cultural aspects that Mohammed covered, yeah, I guess it's just a matter of, once again, that cultural approach. We are custodians of the data, and yeah, we are then engaging in a process of translation. So it's important to harness the data using these really interesting tools, Power BI and so on, and not recreating or not telling, presenting the data as we have in the past. There's interesting things we can do with it. So, the more interesting we make it visually, the more we can do with it. Yeah.
Thank you, Mohammed, Zainab, Usman, for the amazing leadership that you are showing across all of our work, and especially in bringing that data to life and making sure that it gets used and leads to real impact, which is the essence of data and learning, right, for all of us. I want to bring this session to a close by first thanking and sharing our gratitude with USAID. And, this is a brilliant move, a whole month of celebrating evidence and learning. We highly support it. Well done. And thank you for this opportunity to have Relief International come and share a little bit of our work and our culture on this front with everyone here. Thank you so much to the audience for joining us, for the great questions, for the engagement. There were many more questions than we were able to handle in this session, and hopefully we'll have another opportunity to come together with all of you. I want to end the session by sharing some of the really awesome quotes from my amazing colleagues here. The first one is about liberating data from meal systems. That is what we're all about. Data collection has been done, will be done. It's really about utilizing that data, and that's what these three teams have done so well. Accountability in collecting data and data accuracy. Zainab, you were talking about that, which is so much about trusting data, right? That's what you're talking about. It's anyone who is getting that data at such a crucial time, having the trust that this is telling us the real story of what's going on, and then basing decisions, basing resources, directing effort, resources towards that. That is so key. The true spirit of collaboration that all of you talked about between, not just within our own teams, but with the community, with our community partners, that is so crucial. And Mohammed, you were talking about the open channels of communication with the community, which gives us accuracy, which gives accountability, and which really ensures that impact is made possible. And we got that feedback channel going. So critical to everything that we do. Keep improving the meal tools, because the world is offering us so many different solutions, and with AI going the way it is, it's a geometric progression of the way things are changing. And then finally, transforming data from a static state, Usman, your words, to bringing it to life to inform our actions. Data harnessing, listening to data, and make us smarter with our actions. Thank you guys. Brilliant work, brilliant leadership. It is such a pleasure, and really so proud that we are part of the same team. It is so good to be with all of you. Thank you to our audience for joining us. We wish you an amazing rest of your day, wherever you are in the world, and we will sign off from Relief International. Thank you.
Thank you.